to two Utah girls. They started to feel a bit dizzy, lightheaded, weak. It wasn't the flu or a common cold. After a process of elimination, doctors discovered they both have POTS. That's P-O-T-S, a rare disorder that put both in a wheelchair and on a feeding tube. Good for Utah's Nadia shares their push for awareness.
Emma Heidelberger and Brinley Bennett spend a lot of time together, watching TV, listening to music, and sharing something only the two of them truly understand.
It's really nice to talk to someone and compare our symptoms, because like, hey, do you get this? Is this like a thing with POTS that you get?
POTS, like pots and pans, stands for
Postural Orthostatic Tachycardia Syndrome.
It's a mouthful, and it meant big changes for 13-year-old Emma.
Dance was like my life. I did dance competitions. I was at dance all the time.
You can see a very active, dancing Emma right before a medical whirlwind came her way just a year ago.
It didn't really hit until October 1st when I woke up and I couldn't get out of bed.
I thought, oh, it must be the flu. She must just have the flu. But then the next day, it wasn't any better. And then her heart started racing.
After several trips to the doctor, Emma's mom, Marcy, watched as her daughter's condition worsened with few answers as to why.
In the beginning, when we didn't know what she has, she wasn't being treated, she was in the wheelchair, and it was hard for her to even get up and walk. She had to drop out of school, so that was a real low point.
So the Heidelbergers came here to the Salt Lake International Airport and flew to Colorado. That's where Emma was finally diagnosed with POTS syndrome.
When he said that, I was almost like, finally, there's something that I have and there's an answer to this. I now know why I'm having this pain and I'm having this dizziness and nausea. And so it was almost a moment of relief for me.
But for Emma's friend, Brinley, it took 15 months for a POTS diagnosis.
I was bedridden for about 2 years. I was homeschooled all through. It all happened. It happened when I was in 5th grade.
Primary Children's Hospital pediatric cardiologist Dr. Susan Etheridge says getting a diagnosis is the hard part.
Fatigue, musculoskeletal complaints, heat and cold intolerance, exercise intolerance, shortness of breath, a lot of very kind of generic symptoms that don't point to any specific thing being wrong.
Dr. Etheridge says it's a problem with the autonomic nervous system that controls your heart rate and blood pressure. When that's off, it produces a long list of symptoms.
To what we call venous pooling, which is where the blood kind of wants to go down to the lower body and hang out in the veins, leaving less of it in the core and therefore less in the brain. But there isn't an easy blood test or genetic test or anything that says you have POTS. It's more recognizing that the symptoms that are associated with it.
Emma and Brinley traveled to the Mayo Clinic in Rochester, Minnesota to work with specialists. Emma was slowly getting better, a relief for her parents and 2 sisters. But this past July, she developed a rare form of POTS, which affects your stomach, leaving her on a feeding tube. Despite that setback, she and Bryn are now back in school doing half days.
Yes, I'm getting better. I still have bad days. Sometimes I have good days. I'm not bedridden anymore, so obviously it's getting better. I can eat now.
Through all the ups and downs, the girls stayed optimistic. Katy Perry's song, Roar, helped inspire that hope. You can see in this YouTube video, Roar offers sick kids around the world support to keep battling. And last month, Emma got the chance to meet her idol.
I told her that, Roar has really helped me get through my illness. And she, said, I'm so glad my music inspires you, and I wish you the best.
And Dr. Etheridge shares her inspiring words about young POTS patients.
They do some lifestyle modifications, but most of them, by the time they're in college, are actually starting to see a significant decrease.
But a new study shows some 82% of POTS patients reported persistent or worsened symptoms. Emma and Bryn hope to be part of that 18% who grow out of it. And now Emma's mom, Marcy, says she's worried about other kids too, struggling to understand what's making them sick.
If they see these types of symptoms, don't dismiss it as anxiety, don't dismiss it as the flu. You really need to listen to your child. They really know best what their bodies are telling them.
In Sandy, Nadia Crow, Good for Utah.
Again, the POTS diagnosis is really done through a process of elimination. There are a handful of doctors in Utah who know the signs. If you're looking for more information about POTS syndrome, head to our website, goodforutah.com.